So the slot issues, there have been a lot of slot issues in the beginning, specifically for lymphoma, what is now the case for myeloma as well. But what we learned with lymphoma is that companies and hospitals became much more efficient in organizing, selecting patients. So we don't have the really issue of slots for lymphoma at the moment. We have issues with slots with myeloma patients, obviously, because the companies usually tend to not anticipate the demand that immediately exists after approval. But there are a lot of things that hospitals and the healthcare system and companies can learn from. That's obvious. Not everything can be perfect from the beginning. But CAR-T in general, especially commercial CAR-T, continues to be a very expensive and very complex therapy. So whether we can maintain this high volume of CAR-T cells, especially when it comes now into first, second line across diseases, that's a big issue, and that needs to be discussed because, in my opinion, first-line CAR-T cell for myeloma won't be possible at the moment, organization-wise. So, but it's just a matter of how to talk to pharma companies and hospitals and how we organize each other the best, and then I'm sure we'll find a solution.